Okay. The position of the patient, you want to place the patient in the semi-prone or seated upright position.
What time now?
Demonstrating the seated upright position. You want to place the patient's arms in a comfortable position, whatever works for the patient. You want to make sure you put a sheet on the table because patients do not want to put their face on a dirty table. You want to adjust the patient's shoulders to lie in the same horizontal plane. You don't want one up and one down. You want them both to be symmetrical. Now the position of the part. You want to center the affected orbit to the middle of the IR. You want to rest the zygoma, the bottom zygoma, the nose and the chin on the table or the upright pucky. You want to adjust the flexion of the patient's neck and place the acanthomeatal line perpendicular to the plane of the IR. The acanthomeatal line is right here. You want to make sure that that's going directly down in the IR, perpendicular. This will help if you use a pencil. Make sure it's perpendicular. Then what you want to do is adjust the rotation of the patient's head so that the mid-sagittal plane forms an angle of 53 degrees to the plane of the IR. And that's difficult to get because 53 is very precise angulation. So there's nothing wrong with using a protractor and coming around to the patient's head. You want the mid-sagittal plane to be 53 degrees with the plane of the IR. And that's right here. Okay, I would say this is good enough. Next, what you want to do is the patient's head should be immobilized, and you could simply tell the patient, please try to hold this position, and the respiration should be suspended for the exposure. As far as the central ray goes, you need to be 1 inch above the top of the ear attachment, which is, hers is right here. You need to be 1 inch above, so that's 2 fingers. And from that point, you need to be 1 inch posterior. So this is where we want our central ray to be. Remember, you're in descent, so all you have to do. Okay. So 1.5 inches superior and 1 inch posterior. Right there. You want to collimate tightly. You don't need too much collimation because all you're interested in is the orbit, and that will give you better contrast. The central ray will exit through the affected orbit that is closest to the IR, and you want to make sure your central ray is centered to the tape, to the IR. And this is our patient positioning. We're going to next move on to what the image looks like and to the evaluation criteria. And like I said, since this is done for comparison, what you'll just have to do is turn your patient, have them face the other side. Make sure you change your IR if you're using CR. Once you take your exposure, you're just going to move to the other side and do the same thing. You're going to get your acanthomeatal line perpendicular to the plane of the IR. You're going to look for your top of the ear attachment. Once you have distinguished your 53 angulation with the protractor, you're going to go 1 inch superior to the top of the ear attachment and then 1 inch posterior to that point, and this is where your central ray will go. right there. You're going to collimate to your field of interest, which is around the orbit, and you're done. You tell your patients to hold their breath, and you take your exposure. You can relax now, Nadia. We are done with you demonstrating. I would like to show you what the x-ray would look like. The x-ray would look like this. And this is the anatomy you will be able to see. You will be seeing the superior orbital margin, the lateral orbital margin, the optic canal and foramen, the meatal orbital margin, the ethmoidal sinus, and the inferior orbital margin.